Good morning, everybody, and welcome. We're just going to wait a couple of minutes for everybody to join, and then we'll kick off this webinar on how process automation can improve clinical outcomes and patient care. I think the numbers are growing. I can see about to reach 40 people, which is great. For those of you just joining, welcome. We're just waiting a couple of minutes for everyone to get in, and then we will kick off. I think if we make a start, so welcome to this webinar on how process automation can improve clinical outcomes and patient care. My name is Tremaine Noel. I'm the Head of Emerging Technology at Northampton General Hospital, and also am the Programme Director for the Automation Accelerator. Worked with 30 trusts across the NHS, supporting them with their automation journey. So I'm joined by three other people who are allowed to introduce themselves. Paul.
Hi there. Hello, everyone. I'm Paul Wyman. I am the automation architect for the Dorset integrated care system.
Anjana.
Hi, my name is Anjana, and I'm a senior solutions engineer at Laserfiche.
Hi, my name's Simon, and I'm account manager for Laserfiche.
Great. So just to introduce the format of this, so we're going to have a 30 minutes of panel session, and then we'll open up for 20 minutes for audience questions and answers. And we're going to talk through a range of things. So we're going to talk through RPA examples in regards to processes that reduce clinical admin burden, automation as a route to benefit patient outcomes and experience, opportunities for new areas for our creative work. And we're also going to be focusing on how do you scale and introduce automation safely, and how do you tackle governance, compliance, and that key safety element. So I think to kick off, so Paul, during the last year or so, really, you've been using automation in your across Dorset. How have you used it to support patient care?
Well, several ways actually. We've had back with the when we had COVID antibody testing back in August last year. That was probably one of the first major successes we had. We had to test all of the social care staff in Dorset for COVID antibodies, and that was going to be a large project. I think we're looking at about 22 people were going to be needed on a sort of temporary basis to sort of start managing the antibody testing and getting the results back to the patients. And it was a bit of a long-winded process because the results were coming in without contact details. All we had was NHS numbers. So it built an automation which took about 5 days to build. And we got it up and running, and it ran for the 8-week process, 8-week duration for the whole of that process. So that was the sort of social care staff stuff. And we also had oximetry testing, which is still ongoing now. So if you are susceptible to low blood oxygen, and your GP decides that you could have problems if you are positive, they need to know as fast as possible so they can get an oximetry meter to you. So we've been running an oximetry testing now for over a year, and the process is just a dream. It would have taken 3.5 hours per day for people to process these results. And we've been processing it, and it's been taking roughly 2 minutes per day to actually process. So those are two really good successes we're happy with. So
yeah, that sounds like some really big impact there. How did your organization sort of respond to that? So what was the sort of feedback you had seeing all of this automation happening?
I think it's they're sort of we just do it really. We just sort of get on and do the stuff now. They're quite used to it. I've been getting a lot more positive responses from external people who haven't come across automation yet, and they're seeing this sort of art of the possible with what we could be doing. But we've been doing automation for some time now in Dorset, so it is not such of a surprise anymore. They're sort of getting to expect it, which is good.
No, I can relate. I think when we first started, we had a conversation where people sort of expecting to see robots walking through the corridors. So there is that initial sort of transition to get people sort of clued up around what this is and how it can help. Simon and Anjana, what have you seen with the clients that you've worked with in healthcare in terms of how they've used automation to support patient care?
So one of our major successes has been with the Essex Partnership University Trust. So they provide community health, mental health and learning disability services for a population of about 1.5 million people around Essex, obviously Bedfordshire, Suffolk and Luton. And they employ actually themselves a total of around 5,000 members of staff across 200 different sites. And they were looking to have a greater degree of automation in their electronic medical record system. So that's where they turned to Laserfiche to actually provide the content management sort of backbone for that, also using together with Adobe Lifecycle products. And yeah, we started off with actually a pilot project there in their forensic services department, and yeah, we were looking at really a kind of a strategy to sort of modernize how their live patient records were accessed, as it was kind of pretty apparent that manual processes were not really in keeping with being very state of the art and the kind of the high quality of care that they wanted to deliver to their patients. And it was actually proving to be a bit of a drain on time, and actually taking away from that sort of high quality of patient care that they did want to deliver. And so yeah, working together with them, we used Laserfiche scanning to kind of input, sort and file that constant stream of patient information that is coming in. We're looking at workflows to actually route the information to where it needed to be for reviews, for approvals and for submissions, and then actually making all of this documentation accessible through a web portal, so that people could access them remotely, across all the area that the Essex Partnership Trust actually serve. And additionally, adding on to Paul's point, we did also with the Montgomery County Hospital District based in Texas, we implemented a system for them to have an automated forms-based process to report whether or not the employees there had a positive COVID test, so to clear whether or not they were safe to return to work, and to have all of that process documented. So again, that the employees would be able to actually get back on the front line when it mattered most, and actually be able to deliver that patient care to who they were supposed to be servicing.
And that's really great. And same question I sort of asked Paul. I mean, what have you seen in terms of how trusts respond to seeing automation and the sort of impact it's had on them? And do you ever encounter any barriers, in terms of maybe misunderstanding or fears around automation, that side of things?
Yeah, well, I mean, so as I mentioned, with working with the Essex University Trust, we actually did just start off with just a pilot in that forensic services department. But since then, so it was only starting off with a small number of users there that would actually have access to the system. But they did actually have such a success with it that they decided to roll it out to around 3,000 plus users all across the sites where they work. So that would actually give a sort of standardized information management system available to all of them, eliminating the need for different systems across different departments, and yeah, really providing different use cases than what they had originally envisioned for automation. So even though it started with just those medical records, they were able to look at actually doing the same in their human resources department, in their finance department, and again using the Laserfiche suite to automate a number of different processes, and even with content that's stored within there, whether that's again, go back to like the patient records, whether they need to apply any retention schedules or what kind of information governance, policy, procedures exist that are relevant to them there. And yeah, so having these automation tools available to them made them realise actually that they could expand that usage across the trust.
Great. So just a reminder to everybody that you can ask questions in the question and answer section below, and we'll get to these at the end of the session. So Paul, Simon's just mentioned how obviously they started in one part of a organisation and it sort of scaled in terms of opportunities, then looking elsewhere in HR on that side. Where have you looked at across Dorset in terms of different areas of application for automation, and kind of almost where's next for you?
We started looking in the contracts teams. It was probably a bit of a sort of selfish way of looking at it, but we were starting up with the RPA and we thought, well, okay, who's going to be paying for it? With the finance team, so we better sort them out first. But then when COVID came along, it changed the way the contract team works for everyone in the NHS. So there's no need for that. So then we started looking at with COVID sort of processes. The next sort of areas we're going to be concentrating on, we've got the Dorset Care Record going live soon, and we need to send patient invites out to 800,000 patients. That's one process which we've worked out will take 38,000 hours, I think, to invite every single person if you go through the manual interface. But that's one of the automations we're building at the moment. We're going to get clinicians to invite patients and then just send an email to the robot that will process it for us. Other areas, I think probably the biggest would be onboarding of staff across all of the hospitals and trusts and GP practices. And if we could bring that together using the ESR system and all of the trust systems, I think that's probably going to be the biggest time saver of all. I think you're doing something similar to that already, aren't you?
Yeah. So I think, yeah, it's an interesting one, because I think that for us, it's similar to you in that you almost look under the hood at what's out there, and there's clearly like loads of opportunities. So you mentioned like that, tens of thousands of hours saved, and I think we've seen things around like some of those manual back office stuff around, for example, merging patient records in pathology. There's a data quality team that sit and do that, and there's lots of other things they can support with as well, and actually taking the burden off them, that particular task, then that they can then focus on other areas of data quality, security and protection. So and then I think other teams, I don't know if you found this, but other teams seem to get jealous almost, that they're like, how come they've got an automation and I don't? So it does spread quite quickly, which is and good.
A lot of the people that you automate processes for now start evangelizing RPA and to other people. And we have a process where people submit projects through web forms, and they can just type in what their project is, how often they perform it, click the button, and it goes through an automatic assessment. And that's been very useful. And in fact, I was looking at an article from the Oxford Internet Institute. It was written last year, and it was referring to admin procedures within the NHS. 44% of them can be automated. And that's a huge amount. That's in primary and secondary care, they reckon. So I thought that was very interesting.
Yeah, definitely. And Simon and Anjana, where do you see from what you've seen so far, some of the biggest areas of opportunity really for healthcare to use automation?
Yeah, so I mean, as we know that pandemic has hit all the industries across, and we saw a lot of disruption during the pandemic. This long-term disruption really highlighted the benefits of adopting new technology. For essential health services, medical facilities needed to maintain continuity of patient care while also managing the spread of COVID-19. Solutions such as Laserfiche enable healthcare providers to automate repetitive tasks so that staff can focus more on the patient care and pandemic management aspect of operations. So I think, yeah, I mean, we saw a huge shift towards technology, and Laserfiche is able to fill in all those gaps. And like we have SMS technology, use SMS for appointment reminders and dedicated patients. Likewise, healthcare providers can correspond with patients who are in their own homes, lessening the number of patients on site and controlling the COVID. So yeah, we have seen a huge shift as pandemic approached and how Laserfiche came into the picture.
Right. And I think moving on to the next bit, I think that with, as you mentioned, there was a bit of a naturally a sort of seismic shift in the way that technology had to be used, and we've moved into sort of personalized sort of patient experiences. So looking at different technologies around, appointment reminders, patient portals, adoption of new technology, connecting care records and that side of things. I think what's really interesting is that there's often people, the quote almost going around the NHS at the moment has been sort of that there's 10 years of transformation in a matter of weeks. I suppose, like, have you, and sort of open question to all of you really, and maybe Paul, you want to go first, around have you seen a sort of shift in your organisation around maybe the ease of conversations around automation and what it can do? So I've noticed in our own organisation, I think when you do go through a crisis and a huge challenge, people sort of go, actually, let's do things differently. There is no time to do some of these admin tasks. Let's focus on the key things such as patient care. So it kind of came to light, really acutely how important technology was. Did you see that in your organisation?
Yeah, I mean, adopting all of the sort of any new technologies you come out with, it takes quite a lot of sort of pushing of the technology. I'm just thinking, actually, Microsoft Teams, we rolled it out in beta in a small sort of area within finance, and I remember there was there's quite a few people saying, oh, I'm not sure about this, I don't think it's really going to work and whatever, and then we were using it for a couple of years, and it sort of gradually sort of seeped through the organization. People still didn't really want to use this at all. And then just when COVID happens, it's instantaneous. Everyone's using it. I mean, it's been a lifesaver. With RPA, it's been very similar as well. I mean, they've just said, oh, hang on, we can do all of these processes using RPA. Well, yes, that's great. Let's get on with doing that. So yeah, technology has been accelerated by COVID, and adoption of the new technologies. People are much more willing to look at new stuff now. And it's probably in the private sector, I think people are a lot more sort of willing to try new stuff, and we're a little bit slower in the public sector. We like to sort of make sure it's all perfect first, but yes, no, it's been good.
And
I'd have to agree with that, actually. I mean, they also sort of necessity is the mother of invention, or maybe adoption in this case, but it's definitely been a lot easier to have those conversations with people. I think the pandemic has sort of meant that they've had to adopt a whole raft of new things, and some are going to be popular and some are not. Whether you look at things like having an appointment with a GP like through a video call as opposed to actually going there in person, that might be one of those things that had to happen, but it's maybe not so popular. People would rather like actually meet with a person physically face to face. But it's definitely been easier to have those conversations around what automation tools can do in order to actually ease that burden. And one of the prime areas is obviously looking at those back office processes where really people want the submission of information to be as easy as possible, but they also want the accessibility of information to be easy, to be able to find the right information at the right time. So yeah, certainly in terms of having those conversations, it has been easier. People do seem to be much more open to the concept of things that might be able to save them time.
That's really interesting. I think it sort of resonates with some of my experiences around people actually coming with solutions that they found that they really want. So there was always a few people who were naturally really excited around technology, and sort of the usual suspects who would go, look, I found this really cool solution, but actually sort of wider across the organisation, sort of getting messages around, I've heard about this, heard about that, and it's kind of sometimes nice to go, we're using that actually, and here's how you can get involved with that programme. Which is great, and I think that's kind of the power of automation, really, in the sense that it can be used to support everyone, really. So one of the challenges, I suppose, in healthcare when you use automation is often the fear around what happens if it goes wrong. And one of the key things, I suppose when we're doing automation, as in us here, we know that automation is obviously going to help reduce some of that human error. But I suppose the question is, how do you see organisations, what advice would you almost give them in terms of good information governance and going about that sort of governance element? Paul, is probably best for you to start in terms of how you've approached that IG and just general clinical safety and that side of things when launching automations.
Yeah, so well, the first part of all of the projects we ever look at is you'd be filling in a DPIA first of all for your where your data is going to be stored. That's drummed into us in the NHS from day one. If you start a project, you firstly get a DPIA and fill it in. I work for the CCG, which is soon to be changed to the ICS, but from a CCG point of view, we don't look at patient data. So if you work in a trust or a GP, you see patient data all the time. So starting a project from CCG point of view where you're saying is, well, our robots are going to be accessing all these systems with patient data. It's then having to interface with all the IG teams across all the hospitals and whatever, and then get all of these the DPIAs up and running. And then for every little tiny project you do, you adapt your DPIA to as it's an organic thing that grows. So that's from the IG point of view. I was just that came across as there was a question up here as well. Somebody was asking about. I'll catch up with those in a minute. I just saw it gone past, but it's whizzed past now. What else is there? Sorry, there was something else to ask as well.
So it's fine.
Distracted.
So I think, no, don't worry. So I think with the information governance bit, one bit you'd mentioned when we had a chat about this previously was kind of like almost good IG is we were talking about it almost being invisible, but actually we were thinking more around the sort of invisible to the patient because of the safety. But actually,
that's right.
One of the interesting parts is almost good IG is information governance that actually supports you to use data. It's about using it safely rather than stopping you using it. So have you found that sort of how have you found that in terms of building relationships? Has it been pretty smooth going? Has it been a bit challenging at times? Like how has that worked for you?
I have a brilliant IG lead. He has always stood there and said, IG is here to help you share data safely. It's not here to stop you from sharing data. And they've been superb all the way along. Obviously, every time you're building a process, you're very careful about what you do with the data and stuff like that. And for many reasons, this is why RPA is so much more secure than having just people running processes. Humans make mistakes all of the time. If you develop a robotic process that is sharing data safely, it will always share that data safely for you. And we do have to be careful as well, because I think we were talking earlier saying about a member of staff can make 100 mistakes a year, and people will just say, well, okay, it's a bit of a problem. A robot only has to make one mistake in 10 years. And people will be all over it and whatever. So we have to be very, very careful from the robotic point of view and creating all of our solutions.
And Simon and Anjana, does any of that resonate with you in terms of what you've seen around sort of governance and that side of things, especially in sort of regulated industries such as healthcare?
Yeah, so I mean, like you mentioned that healthcare organizations handle an abundance of patient data and sensitive information. And if that information was compromised, that would be a disaster for both patients and the clinic, right? It is a relation of trust. Storing data in Laserfiche as opposed to on paper, it enables the easy retrieval of patient information and improved information governance. But then we have to keep in mind data security, regulatory compliance, and privacy laws at a larger role, which play a large role in decision-making process. So we try to be, at Laserfiche, we always strive to be strive on quality side of things, and we are certified with DoD verse 501.15.2, and we are also GDPR compliant. So like Paul mentioned that they have a DPI officer, we also work very closely with our DPI officer and try to be GDPR compliant so that at no stage the client data or clinic data is compromised at any level. So that's the idea, how we want to make it 100% secure. And there is no data leakage at any point of time.
Sure, that makes sense. And in terms of doing automation at scale and growing programs, I mean, Paul, what do you see as some of the biggest limitations to maybe growing at scale and some of the things you need?
Probably manpower to get them up and running. That's probably going to be the biggest hurdle. We're still in early days with RPA and the NHS, so yeah, I guess I could probably do with a team of about 100 people, and that would probably just about do it. So
no, that's really interesting, and I think we've found that the more the more you look in terms of automation, as I said, the more you find. It's kind of like at the moment we've got almost like a huge pile like this where it's just constantly taking the top load and working through them. So probably a question for Simon and Anjana, in terms of using so your particular tool and scaling, what sort of structure would an organization need? What sort of investment in terms of resources and people would you sort of recommend for sort of getting a sort of sizable almost like centre of excellence and up and running for automation? Do you have any thoughts on that really?
So, I mean, in terms of growing at scale, I would say it really depends. We try to chalk out a plan. It's always about having a right plan in place. So we try to bring that plan in place and then start implementation. So in terms of implementing at scale, for us, it's all about managing the resources. So like in Laserfiche, we have cloud availability, we have on-prem availability. So the idea is, and we have dealt with customers like from 100 customers to thousands of customers. So really scaling the project shouldn't be a problem. It's all about having the right plan in place.
That makes sense. And what is the most, and sort of open to everyone here, what's the most exciting application of automation that you've seen or had talked about? Have you got any thoughts on that, Paul?
The most exciting? Oh, I don't know. Well, probably the first one I came across with Darren doing his electronic referrals. I think that was probably I was saying that when we first started out, we're going to use contracting. I think Darren had also started doing a similar thing when he first got up and running, but he decided that he should then switch over and then do the ERS to EPR. I think that's probably the most exciting because it's suddenly taking a process which is printing and scanning for most, or for a lot of hospitals and trusts around the country, and suddenly dragging it into the 20th century. I know we're in the 21st, but you know, we should have been doing it years ago. Yeah, I think for me, that's probably it would be the first one I saw and went, that's what we should be doing as well.
That makes sense. Simon, what about you? Have you seen any sort of exciting ideas or use cases?
So I think for us, probably one of our recent ones was with Nature Coast, which is a hospital based out in Florida, private hospital, and they have been using Laserfiche to manage their data security. So as Anjana mentioned, they actually went for a cloud hosted solution, but they are using Laserfiche to manage their data security, the regulatory compliance and privacy laws that they have to contend with over there as operating as a healthcare provider. So yeah, for them, utilizing that cloud technology and being able to set sort of different access and folders, managing how that information was retrieved, what the retention schedules were that were applied to that. So using Laserfiche records management that could be automatically applied, and that could facilitate not only the staff's ease of access and retrieval of that information, but also the patients about having their information held in that system. That enabled them to feel really confident about that, and that information was being held securely.
So we've got a few interesting questions that have come in, and we'll again, if you do have any questions, please do put them in the question. We'll ask them to the panel. So the first one's from Stephanie, and it's around what is the biggest governance challenge that you have had related to RPA, and how did you overcome it? So Probably Paul, I keep coming to you first, but I'll come to you first.
What's the biggest governance challenge? I think this was the message I was looking for earlier. Biggest governance challenge. I don't think we've had too many.
Yeah.
Really, I mean, it's been quite accepting. I think this is probably part of, it was with COVID, it's the pandemic, and I'm not saying that rules were relaxed. I think people were more willing to accept the sort of new ideas, and then everybody was working together much more efficiently than we would normally. So I wouldn't say we've had a really big one. I think probably maybe being a CCG and seeing patient data was a big issue. So
yeah. So I think if I reflect on it, one of the challenges I think we've had is when you build automations around clinical processes. So sort of the bar there is much higher in terms of success. And we've built an automation and it ran successfully, sort of 500 times. But you always look at it and kind of go, when is the point at which you can go, yeah, that's that we're happy with that. So some of that we found was kind of testing that beforehand, but naturally it's kind of new to lots of people, including like IG teams. There isn't like a manual on IG and clinical safety for our PA. So I think and also it's kind of been helpful. I don't know if you found this, but helpful working with like CCIOs, CNIOs, because they are really great in adding that sort of clinical perspective and also helping you build automations that are even more useful. Because I've found like some of the ideas we'd had have been really enhanced by that input. Have you found the same with that sort of? Have you looked at clinical processes? I think you've mentioned a few, but how have you found sort of that side of things?
Yeah, we've got a lot of the clinical processes we get submitted. They're coming from all different angles as well, and we've got. I think probably one of the ones we're looking at the moment is the dermatology or teledermatology pathways. So we're looking to automate when the data comes in as a referral from a GP. We want the robotics to look at the referral, and if it says please refer to attached photo and there's no attached photo, we don't want clinicians like hunting around through the ERS system for the photo that doesn't exist. So we'll be using sort of the NLP or natural language and processing and stuff to look at the referral letters to see if there's things missing, and then pass that back to the GP admins to say, should there have been an image attached to this? And there are occasions when they just don't attach the images because they're too personal, or maybe it's an issue with teledermatology where it's a sweating issue that you can't really photograph and stuff like that.
No, that's interesting. And I suppose you've just touched on something quite interesting, which is sort of NLP and that side of things. I mean, so probably a question for maybe Simon and Anjana around, so obviously with your tool, do you see sort of exciting use cases and ideas sort of using some of those other technologies alongside, so AI, machine learning, albeit lots of the NHS automation at the moment are quite basic, but where do you see sort of technology going in that sort of direction, and how can you almost pull that into automation as well?
Yeah, so we have been good that you mentioned about the NLP and AI and machine learning. So we have been using AI and machine learning in Laserfiche for quite some time, and that has really helped in capturing the data for clients. So if it's for NHS users and patient records, it captures the information. So there has been a shift in terms of AI and ML, and we can see that our organization is heading towards this AI and machine learning. But yeah, I mean, we can say that there has been like good capture of information, good process automation in terms of having this automated. Simon, do you want to add anything?
Yeah, I think those kinds of tools are definitely becoming more and more prevalent. In terms of NLP, that's not really something that Laserfiche has any offerings in right now. We do have some AI-powered capture that we are working on, and it works mainly right now for invoices in particular. So say correctly identifying certain fields or like amounts, suppliers, that kind of thing, and that is something that we're looking to hopefully be able to scale out to to other applications. But then other than that, also, as you mentioned with RPA, we do have some RPA functionality as part of the Laserfiche platform. So it consists of essentially like a designer. So a lot of it's actually quite low code or no code. So all you just need to do is record how you would perform those actions using our sort of natively built RPA. And so for anything, you know, like filling out forms or taking, you know, information from one system to another, that is something that Laserfiche can do. But yeah, not as yet in terms of NLP as much.
Sure, that makes sense. So another question here from Claire, and that's around did you notice any improvements to process reliability alongside burden reduction? So I know that that's kind of been that's kind of the key thing, is that you do see that. So it's unanimous nods, but is there any sort of comments anyone wants to make on that?
I think let me think of a project, probably the oximetry one again. We're getting what, 1,600 results per day coming in at the moment. And if you've got a member of staff that's sitting there going through a CSV file or an Excel spreadsheet, copying and pasting or filtering on GP practices, putting into this email, sending it out, there will be mistakes. And unfortunately, I mean, we are human. So yes, I did look at it. I think we've been processing about, I think there's about 130,000 results we've processed so far. There was one error on one of those, but that was a human error. That was my fault for putting the wrong email address in the wrong box, but it only happened once and we fixed that. But that is the only situation where we've had an error. And if somebody had been doing that day in, day out, there would have been a lot more errors.
Yeah, that makes sense. And then the next question is, how do you demonstrate just return on investment? So and I think part of that is also, I think, reflect on the fact that ROI is in different ways. So I know in our organisation, there's obviously a difference between time repurposed, cost reduction, patient safety. I mean, how do you balance all of those? Sort of open question really, but how do you balance all of those sort of ROIs, and how have you measured, how do you sort of propose measuring that maybe, and maybe how have you seen people go about that?
Every single one of our processes, when we first go through the submission of it, we know how long the process takes a human to complete. So when the process runs on the robotic system, it stores each run in a SharePoint list, and we have a Power BI dashboard that records how many minutes and hours are saved. So our return on investment is reported back to the finance director as the number of hours that we have saved staff. It doesn't take into consideration that the value added, that what are those members of staff now doing with those returned hours. But I was told by my CFO, don't tell me how much money you've saved, because otherwise I want a bag of gold at the end of it. Just tell me how many hours and I can work it out in my head. So.
That's so true. The next question is RPA making enough difference on the elective care backlog, and what can be improved on to get more out of RPA? Who wants to answer that one?
Just to quickly touch on the return on investment question. We'll just go back to that very briefly. Another important thing to consider is actually obviously the costs associated with using legacy systems. So, you know, if something is really slowing down your ability to work, you know, to actually like look at that and make that assessment and see what the difference would be with going over to a new system. And then obviously, as Paul mentioned, obviously any particular time savings with any particular processes, that's something that you want to be factoring in, and looking at the complexity of the existing process as a whole as well. You know, is it basically taking too long? That would also sort of come into it, as well as also looking at different methodologies for implementing. So I mean, we tend to go on like an agile methodology, so to do it in like increments. So you could look at maybe doing like a pilot project, and then going from there. So you're not necessarily putting that massive investment up front. You know, you can kind of stagger your rollout of any new solution in any area. But sorry, yeah, you were saying on to the next question. Just wanted to add that in.
No, that's great.
I was just going to mention about the elective care bit. Probably EOS referral automation. That's a good one, because if you're sending a message back to a patient 3 days before their appointment, that could be an SMS. Send them an SMS to say, can you still make the appointment? Press 1 for yes, 2 for no. If they can't, then at least you can clear the appointment slot then. I don't know of anybody who's doing it yet, but if you could automate the next stage, which would be then going into the elective care waiting list and tail gunning the patients at the bottom and offering them an appointment in 2 days' time, that would make a huge difference. Are you aware of anybody who's done that, Tremaine? Are you doing it?
Not that particular user, but what we're kind of doing a lot of work at the moment, sort of scoping this. So one of them is kind of exactly what you said in terms of helping with referrals. But one of the key things is kind of keeping referrals digital, which kind of sounds odd, but naturally a lot of them get printed off and then put in an in tray for clinicians. So there's that side of it. I think also helping, what we're looking at is how do you help GPs make better referrals? So I do not envy primary care in terms of trying to remember all of the different speciality criteria to make that appointment, and the supporting that and supporting getting the right information and stopping some of those rejections because of lack of information would be another area. And like you say, there's sort of appointment management is a massive one in terms, and we're looking at sort of different solutions around that. RPA is one of them, but actually what I'm finding is sometimes you can get by tools that do the bulk of it and then use RPA to enhance the rest, some additional functionality. So there's that side. I think there's also some interesting stuff around the diagnostics. So if someone's on a particular pathway, you can pre-order some of those diagnostics and also alert clinicians exactly when they've been received, especially on urgent waits. I think some of the challenges are sort of live alerts and systems are quite difficult. So we're looking at that in the first part as well, and not sort of tracking, has it been done on time, but almost like, how much time has each of those referrals lapsed, so you can sort of track and see your workload, because we naturally is tracked on sort of trust level, but you want clinicians to kind of have access to that data. And then there's loads of stuff around sort of referrals internally, so to treatment. So yeah. I think it's an area I've now looked into, and it's kind of like, wow, there's tons of stuff there.
I heard somebody discussing about when you book a patient in for an outpatient appointment, it checks, or you could have RPA check the system to see if they're in for another appointment at any other time, and maybe just bring them in one day instead of sending them out to invites.
And that's something like I'm seeing how we can model that at the moment, because it's a key thing, isn't it? Like there's no, and what's quite interesting is, and it's probably timely, it has a big environmental impact as well in terms of getting people to come in multiple times. Maybe it costs, say, a month, when actually you could consolidate those appointments into one day, as well as lots of other practical impacts as well. So I think that's a key area. And someone I think asked around funding. I'm sure I saw the question there. So I think that there is quite a lot of funding at the moment, and if you haven't, I think suggestions to look on the Unified Tech Fund from NHSX that has lots of information on the various pots available, and it's something we're looking at. We have applications for, and most a load of places have. So I think reach out to sort of, if you're not in that sort of area of your organisation, reach out to the CIOs and IT leads and that side of things. So some other interesting questions. So one directly to you, Paul. So have you made the web form for submitting potential RPA proposals open source?
No, I haven't actually. I've put the link into the chat. I hope everyone could see it. It's just a Microsoft web form at the moment. It does a little bit of Power Automate just to sort of process that and put it through a quick formula I knocked up in Excel some ages ago, and it just looks to see how much time and hours it's going to save in a process, and then submits it as well. if I had enough time, I've got lots of other things I want to adapt on that. I want to start looking at NLP to look at the referrals as they come in, so the recommendations for the form, and then compare it with ones we've already got on the list, because I think we had over 400 submissions for ideas for automation, which we shrunk down to about 146, I think it was in the end, which were distinctly different. So some of that overlap a lot, but if that was Mark Bailey, wasn't it? Mark, if you want to drop me a line, I'm happy to discuss that with you. And
I suppose, one other thing might be we've actually got a license for platform use at the moment that we can sort of share with people, which helps us manage all of those ideas. Because I think one of the biggest challenges when you start doing it at scale, so we're similar, I think we're reaching close to thousands of ideas now. But the challenge with that is then managing all of those and managing. So we've integrated that with our DevOps, Azure DevOps, which is to help us manage all of those. So I think there's definitely ways to do it, but it's kind of gradually getting to that point, isn't it? And yeah, it's interesting. So question from Ian is, what do you see as the top RPA opportunities in general practice? Does anyone?
Oh, GPs, right. Yeah, anybody else? Laserfiche guys?
So in terms of Laserfiche, we do a process automation. So like you mentioned that, how do we automate in terms of GP? I would say there are a lot of processes to automate, right? There are multiple processes. So right from booking an appointment and then giving them an appointment, all those processes can be automated. And in Laserfiche, the way it can be done is via web forms. So users don't have to be in the system. All they need to do is a link can be shared with them, and then they can book an appointment for themselves. And then via that link, they can mention whether they want a phone call to be given to them, or whether they want the GP to call them in person. So all that can be automated using Laserfiche, or the business process automation side of things.
Sure. And on that, there's another question that probably fits into this, but what do you have to have in place as a healthcare institution before starting to look at this? So do you recommend any sort of capability beforehand, before getting started with automation? What are your sort of thoughts on that?
I think we need to understand the current process which is in place, right? So like, I understand that at GP practices, there are multiple legacy applications which are being used, and there are silo of applications, like one application interacts with one system, the other application interacts. So we need to sit down and understand what all processes are there, what all applications are there, and how they interact with each other. Once we understand that process, we can take baby steps to start automating and bringing one complete automation, one complete ecosystem in place. So I think it has to be baby steps in taking the automation to next level and creating one complete ecosystem for all the applications, so that they interact seamlessly. And when they interact seamlessly, obviously the wait time would be less. We will save a lot of time, because sometimes it happens, like I can give you an example, when you shift your GP from one location to other, right? And it takes some time for information to be processed from one system to other because of the communication, like the application they are on. But if we can centralize all this information, I think we can bridge the gap and then in turn save some time.
Yeah, that makes sense. So one further question here is, probably Paul, I'll aim this at you first, and when I answer it, I'll have to be selective because there's so much here. But can you share any challenges you've encountered with automation, so maybe staff, processes, data quality, etc., and how did you overcome these?
I think there's buy-in from just about everybody. I think everybody can see the sort of the vision quite quickly, which is strange, really, with a technical solution that you're going to offer to a lot of non-technical people. They get it with RPA. Maybe we had down from SNEF come down and do a little presentation for us and show everybody the sort of art of the possible that he'd done. Everybody in all those presentations, they just got it. So I think that's probably been that's probably been the most surprising thing, actually. You'd expect people to sort of say, oh no, we're expecting to be replaced by robots. That's probably, actually, yes, probably one of the questions you get a lot from people. Is it going to make me redundant? But with healthcare staff, there's so many human traits that you need, and they're a bottleneck for all sort of computerization, that you can't automate these human traits. Yeah. So with healthcare staff, well, I think we're pretty safe when it comes to the robotics. I know that it was people's jobs in out in the private sector. I think I was just looking at a figure here. In Europe, it says 45 to 60% of the workforce is predicted to be at high risk from automation. Not the case in healthcare. It's we were just saying earlier about the number of processes within primary care. The Oxford study I looked at, they identified 16 different roles in primary care and 130 processes which could be automated, but none of them were complete replacements for entire processes for a member of staff, because you still had to have that human interaction. So that was probably overcome. That's the trickiest question I thought, but it turned out to be easier.
No, that makes it's interesting really, because I think you're right. In healthcare, when you say to people, I've got a tool that will make your life easier, and there's here are the ways, it's received quite well, and also because I think people recognise that there is a burden around some of these admin tasks, kind of reporting on what you do, and all of this side of things like can become burdensome. I think for us, one of the challenges was, so it was asked around data quality. I mean, that has been one of them in terms of when you start looking at how do you solve a problem. If you look at automating it first, so I take as an example, the employee staff record, ESR, trying to take data out of that doesn't always give you the best outcome. If you're trying to say, build an automation that messages, member of staff when X happens. So, but what you can do is use automation to then improve that data quality first. So you can have, as Anjana said, around web forms. So one of the cool things with that is you can keep sending out, the opportunity to update your details, and then automation can run in the background and do that. And also add supplementary information, because we're looking at, pulling that out into a database, and how do you then maybe supplement some of the additional things like skills and other things into that record. So there's lots of opportunities to sort of improve data quality. And I think the other thing, and I don't know what you've found with this, Paul, but I've often had to say, naturally, lots of automation ideas, like you don't say yes to all of them naturally. And one of the things that we often have to do is kind of point into the digital strategy and point at, what is there, what is going on, what's on the roadmap, because sometimes like people suggest around using automation as initially, and you're like, actually, maybe using Excel for this one a bit better, not in terms of the macros, but just using some of the tools you have is what the solution is, and then focus some of the automation on those high value. Have you seen that in terms of how have you sort of managed that rejection of ideas?
Yeah, it's sometimes it happens when you're down at the discovering the process level, when you're doing the business analyst process, you're sitting down with a member of staff and you're going through the process they do, but then you do a similar thing with another member of staff doing the same job, and they do it in a slightly different way. And I think when you ask questions like, so you do it this way and that person does it that way, what's the difference here? And have you thought you could do it this way and it would speed it up? And sometimes that does actually get rid of the sort of requirement, because they suddenly, oh, I didn't know you could do that, and it's not, it doesn't happen often, I would say. It's but I have come across situations where it does.
So I think I'm just seeing if there's any more questions, so I think there's a few actually. So understanding around data security and privacy, so I think we've covered that one. So I think lack of understanding of benefits is sort of sharing. So there's something here around sort of data sharing and stopping buying and willingness to share data for the benefit of the patient. I don't know about you, but what I'm seeing is it's actually becoming increasingly easy to do that, in the sense that and not sort of very specific ways of doing it, but actually in terms of NHS moving into sort of working across different ICS patches and forming groups and things, there's a sort of shared potential to do that. So there's a question here around, if someone in primary care is interested in exploring RPA in general practice, how would one go about doing this? So yeah, feel free to reach out to either of us, and anyone here, because I think there's loads of ideas we have. So I mentioned RTT and BTL, like yes, 100% Paul. RTT is it's like ripe for automation, and the patient tracking list, like there's elements of it, I think, definitely. So lots and lots of opportunity. Are there any? I don't think there's any more questions after that, and I think we might, if there's not, we might wrap up. So I think it's been a really interesting conversation to hear of different experiences and hear how Laserfiche solution can benefit organisations. So and it's great to have so many questions. I think this is genuinely probably the most questions I've seen in a webinar. So thank you everyone for that. So hope you enjoyed it, and thank you very much everyone for joining, and have a great rest of your day.
Thanks, Tremaine. Thank you, everybody.
Thank you.
Thanks.
Hello.
I think everyone's gone.
Yeah, I think it's like such a weird exercise, but it's weirder, like just being on your own, like, and like closing the screen like at the end of doing a talk. How did you all find it? That was a super lively Q&A.
Yeah, no,
I can't start my video again.
Sorry, I turned you off. Was
that at the beginning?
No. Could you imagine? You had the power removed.
Yeah, I do have the power. How did you all find it? Do you feel like you got through most of the questions, Tremaine?
Yeah, no, I found it really good.
They were flying in, weren't they?
Yeah, it's great.
Really got RPA really is like, oh, process automation is such a kind of like, people are really interested in it at the moment. But it's really useful for us to see all the questions as well, because we'll look to kind of cover that more over the next 6 months. But it's good. How did you find it, Simon, Anjana?
I thought it went well. Big thank you to Tremaine and Paul for joining us. I think we got through more or less everything we wanted to on our side. Did well, I think, under the circumstances, just kind of getting in drafted last minute. But yeah, no, I think it went well.
Good. So everything will be available on demand for everyone, certainly within a week. So if there's anything you want us to include in the follow-ups, guys, let me know. So that might be any kind of things you referenced, any slides or anything, and we can make sure
we can speak to Jo about that as well. She'll be involved in that.
Okay, cool. That's it. You're released.
Thanks so much, everyone. Really appreciate it.
Thank you.
Thank you very much.
Everyone.
Thanks, guys.
Bye-bye.
Bye.